Hi everyone, I'm Don Grimes, Executive Director and founder of CaregiverGeneration.com, a social enterprise designed for people ages 35 to 65 who will one day have to help an older relative with long-term care and people who want to prepare for their own future long-term care needs. Who the heck pays for long-term care? Now, we typically hope that someone else is going to pay for it. We hope the government will. We hope our health insurance will. Well, let's talk about that. Most long-term care is what we call unskilled care. It's help with the 6 activities of daily living: bathing, continence, dressing, eating, toileting, and transferring. Now, toileting is the ability to get on or off a toilet by yourself and the associated hygiene. And transferring is the ability to get yourself out of a bed or chair by yourself. Those are the things that are typically involved with long-term care. Now, and obviously they're very important, being able to get dressed, being able to get bathed, being able to get fed, but they're not the kind of things or the kind of help that health insurance pays for or Medicare pays for. And long-term care is also when we need supervision or someone to look over us because we have a dementia. Again, very important care, but it's nothing that health insurance will pay for or disability insurance or Medicare. So the reality in the United States today is most of us pay for our long-term care initially out of our own pocket. Except for that very small percentage of people who have the good fortune to have long-term care insurance. Most of us don't, which is a shame. And we'll talk more about that in another video. But typically we pay out of our own pocket. And then we go broke. And long-term care costs, medical needs are one of the, if not the #1 reason why people over 60 go bankrupt. When we've used up all our money, we go broke. And then we go on Medicaid. Different states call it different things. Here in California, it's Medi-Cal. In Tennessee, it's TennCare. But typically, states call it Medicaid, and it means you're broke. And Medicaid is technically a joint federal and state program providing health insurance for the indigent. Indigent's a fancy way of saying you're broken on welfare. So the normal course of care in the United States, or the normal course of payment, as we get older and we need long-term care, is we're going to use up all our money, unless we have long-term care insurance. Then we're going to go broke and we're going to go on Medicaid. Medicare is our health insurance from the federal government. And as we talked about in a different video, it's not designed to cover long-term care. So the good news is we're living longer than ever. The bad news is we're living longer than ever, and there's a high probability we'll need long-term care. That's something you've got to think about if you're a member of the caregiver generation and you're going to be helping an older relative. Take the information, plan for yourself. Thanks for tuning in. For more information, go to caregivergeneration.com.